Are you ready? You sure you're ready? Are you ready? Because everybody loves a quickie, and we're having a quickie today. Honey, let me tell you something. I'm Dr. Shelly. This is my famous Oh My God packet, the study guide to help you pass the Ngn Nclex exam. And we're having a quickie. Now let's go, because it's getting hot up in here. All right, so this is what we're doing. We're doing a walk through the Oh My God packet for the Ngn Nclex. As you know, the OMG packet is the study guide that you have to study for your Ngn Nclex. Now, the page that we're on is Oh My God packet, Quickie, page 6, and today's lesson is prioritization. So this will be actually kind of simple, but it's going to give you valuable information to know how to prioritize and even just dissect the freaking question. So listen, when you go to page 6 of the Oh My God packet, and you need to be going to get your packet because it's going to hit you up and hook you up, all right? So when you look at page 6, the analysis of the question, we must really apply way more value to taking our time on the test and evaluating the question itself. What I tell my students here in Cleveland, Ohio, is that the answer is in the question. So what do I mean by that? Well, when you analyze the question, you must look at the last 5 words first, because if you don't and you're rushing through, which you should never have done anyway, even if you feel like you're running out of time, remember you can pass this test even when you run out of time. I have lots of students who ran out of time. So you have to take your time, and that sounds cliche, doesn't it? Take your time. But what the fuck does it mean? Here's what it means. You should be pacing yourself to do 30 questions per hour. That is very different from what you did in nursing school. And that's why I teach very differently, because when you get to this big guns, the big test, the Ngn Nclex, no, it's the opposite of what you did in nursing school. You must take your time. Go slow, please. All right, so when you go slow, you get this dry erase board, and you can take notes and write notes on that board. And when you do, you're looking at the last 5 words. Now watch this. And by the way, it doesn't matter what sentence structure it is. It doesn't matter what they're asking you. It doesn't matter what the question is. You got to go to the last 5 words. So here we go. This question had to do with the pediatric cancer unit. These are patients on a pediatric cancer unit. You're checking the labs, trying to decide. And the very last 5 words was, who should you see first? Okay? All right. Now, here's another one. This patient's being monitored while undergoing a stress test using a treadmill. Which finding concerns you the most? So if you look at 5 words, 1, 2, 3, 4, 5, who should you see first? Here's another one. Finding concerns you the most, 5. You pretty much know what you got to do. Now, it's not that simple, but it does start to be a little bit more simple. So here's the other part of the simple. When you look at these questions, I want you to make sure that you know how to spot priority questions from any other questions on the test. Sometimes they say, which patient requires follow-up? Sometimes it says, what's most important to report? Maybe it says, what are you most concerned about? Or perhaps it says, which client is priority for the nurse to assess? Or here's another tip. Priority questions usually have the symptoms in the question, and they have they usually have the diagnosis in the question and the symptoms in the answer. So watch this. Guess what everybody's diagnosis is, no matter which one of these you choose. Guess what their diagnosis is? It's a pediatric cancer unit. You see what I'm saying? Okay, let's look at this one. patient being monitored while undergoing a stress test using a treadmill. And you might say, well, but there's no diagnosis in that part of the question. Oh, sure there is. Because if you're smart, you know what diagnosis the patient had to qualify for a stress test. You know what the indication is for the stress test. You see where we're going now? So you kind of know they didn't have an amputated toe. We're not talking about diabetes. We ain't talking about nobody with a psychiatric disorder. It's a treadmill. It's a stress test. Come on now, cardiac players. Okay, so really look for that. Here's another tip. No matter what happens with the priority question answer scenario, you have two issues that you must dissect. Number one, when choosing the right answer, you must say which one of these symptoms could kill the patient, or based on what you said the diagnosis was, which one of these were unexpected. And you'll see what I mean in a bit. All right, now you're not done. Oh yeah, I said the last 5 words was the first thing. Here's the second thing. You must dissect out numbers in every single question. Every single question that has numbers in it, you got to pull them bad boys out. And if it's the answers with the numbers in it, that's fine too. But whatever it is, numbers are high priority. Sometimes the numbers provide the answer. Now, sometimes there's no numbers in the question at all, and all the numbers are actually in the answers. At that point, you must say, well, which one of these could kill me or could kill the patient, right? Okay, so that's another tip. Here's the most important after numbers. Here we go. You must look at the context of the question. The context of the question is the what is the question about, the where are you when we're talking about this question, who is the question all about and who might be in the answers, and when is probably the most important of all the what, where, how, whatevers, because the when is always a timing word. So it may be that the when is immediate post-op. It may be that the when is patient had surgery 3 days ago. It may be that the when is the patient was admitted yesterday. It may be that the patient with meningitis was admitted 2 days ago. The when matters. It may be that the patient had surgery an hour ago. I'll tell you right now, if you get any question on NCLEX and it has anything in it about an hour or so ago, and just the word hour is huge priority question. Okay. All right. So let's move on because we're getting somewhere with this. Now, this is all the context of the question and the answer combination. Now let's tell you who has the highest priority on the test. And I do mean the highest priority on the test. But guess what? I hooked y'all up. I gave you the highest priority in order. Oh my God. Yes, straight from page 6 on the actual Oh My God packet is this page telling you what order to go by. So watch this. The highest priority on the whole test is anybody having behavior changes. Okay. No, not okay. No. Behavior changes. I hope you're taking notes because here's some behavior changes. Agitation, confusion, restlessness, anxiety, irritability, altered mental status, feeling of doom, deteriorating. I mean, just mental status deteriorating. These are all behavior Examples. Apprehension is another one. When patients are agitated, restless, anxious, all of those are behavior changes, and those behavior changes are very related to lack of oxygen to the brain, causing the patient's behavior to change. Okay? They're number one. So when you see patients on the test, and it must be a behavior change. Now, don't get goofy. Don't take the patient that's confused because they've had Alzheimer's for 10 years. No, that's not the patient I'm talking about. I'm talking about the patient that it literally said altered mental status, 86-year-old with altered mental status asking, where is her mother? What you mean, where your mama at? Shit, you 86, honey. Your mama dead. She up in heaven somewhere. She ain't over here. I mean, you know what I'm saying? I mean, you got to really think about that. It's an altered mental status. It told you what it was. Okay, that's number one. Number two, that walked me right up, down the street, the parking lot, and the driveway to status changes. Oh, yes. All of a sudden is my favorite. All of a sudden, fill in the blank. You know that's a status change. How about new onset? You know, they like that fancy $2 word, onset. New onset is a status change, okay? Respiratory distress is the tricky one because you, like me, were taught that ABCs are the way to go. Airway, breathing, and circulation. Now, truth be told, that's all bullshit now. Yeah, ABCs don't work. No, hell no, that shit don't work. Let me tell you why. If you've been paying attention to CPR, you know that CPR changed their ABCs and now the shit is CAB. I hope you've been paying attention to the CPR. So CPR is another name for BLS, or basic life support. And we were taught for the last 40 years, airway, breathing, circulation. The ABCs of BLS. That shit got changed because people figured it out. Nah. Airway ain't always it. What do we do now? What do we say do now? We do circulation first. Yeah, chest compressions. Walk in the room, start pushing on people's chests. Chest compressions is first now. Not airway. No, hell no. So what do you do when you see that I have put here in the third spot? I mean, I put this third and I told you this shit was in order. So what do you do if it says it's third? Isn't that airway? No, not without evidence. What kind of evidence, Shelly? Oh, you need numbers. There's the numbers again. You need evidence that this is respiratory distress. You either need numbers or you need, guess what? You ready? A behavior change. Let me tell you what I mean. When I tell you respiratory distress, I'm talking a pulse ox less than 90. That's a number. When I tell you respiratory distress, I'm talking about a patient with labored breathing and anxiety. Anxiety is the evidence. That's that behavior change. When I tell you respiratory distress, I'm talking about all of a sudden you can't breathe. All of a sudden. So it must have evidence. The pulse ox less than 90 is number one. But PaO2 less than 60 is a close second. And then if it's a baby, evidence of respiratory distress is grunting, flaring, and retracting. Y'all feeling me yet? Okay. There's a lot of respiratory distress songs in my HETV playlist. I hope you're going and look at them because it's all of y'all dancing. All my students dancing. Here's one that never really makes sense to you unless you know your cardiac. Worsening back pain that has a new onset about a half hour ago. New onset worsening back pain, right? So here's what I mean. Usually they're going to give you more than just the new onset worsening back pain. No, they're going to let you know this person's a smoker. They're going to let you know that it started about a half hour or so ago. They're gonna let you know their age, and this person's age is usually over 50, at least over 40, but usually over 50. And so what is this? What is this that made it in the 4th spot of prioritization? It's a AAA, an abdominal aortic aneurysm. And it will be an excruciating, tearing pain, but if you know your anatomy and physiology, you know your aorta lines the back of your heart and goes along your back. So this back pain makes sense. Nobody else would really think cardiac with back pain, but you do because you know your anatomy. Yeah, you. Okay, what's number 5? I would have to say that new graduates miss this the most, like new students, because you weren't taught this in school, but it's a biggie. And that is the immunosuppressed patient with signs and symptoms of an infection. So if they have UTI symptoms, they're in trouble. If they have a sore throat, they're in trouble. If the immunosuppressed patient has flu-like symptoms, they're in trouble. You better know. How about the immediate post-op or the new admission or transfer to the unit? Don't let them fool you. They might say that the patient's been transferred from ICU to step down. I don't care if it sounds like they're getting better. They're a brand new transfer, essentially a new admission for the step down nurse. So they're the highest priority because I told you before that fits the win, the immediate. Post-op is win. The new admission is a win word, right? So you got to be careful. Now, I even gave you the holy hookup on EKGs. I gave you what order the EKG should be seen in. I've seen it where tests give you 4 EKGs, all very different, and you had to know which one of them to see first. Okay. Well, here we go. All right. V-fib is number 1. Don't get it twisted. You ain't got no damn pulse. Of course your ass need to be seen number 1. V-tach. V-tach could or maybe not have a pulse. So that's another second. V-fib definitely ain't got no pulse. V-tach might not have a pulse. You can have V-tach with a pulse or without. Remember I said that. The next one is premature ventricular contractions. More than 6 in a minute, which you definitely gonna see on a test, means that you're having ischemia, like you're having decreased oxygen to your heart. Hello. And torsades. Torsades is very infrequently given, and if you failed a few times, you might get it because you know it's a little higher level. Torsades means that your magnesium is low, and it looks like a tornado on the EKG strip. Torsades, very serious. Oh yeah, you can die with torsades. Now, the last part of prioritizing, the last part of the list, and again, these are in order. The last part is tachycardia, but it has to be a certain number. And of course, page 7 of the Oh My God packet tells you what number is the one that you should see first. And it's a heart rate higher than 110. And that's true for almost everybody, because if you have tachycardia higher than 110, I tell my students that your patient's bleeding and you got to figure out from where. Because tachycardia on any test is hemorrhaging, right? I mean, you know, not always, but most of the time. So a heart rate above 110, you got to figure out where they bleeding from. Hypotension is second to tachycardia. Tachycardia is more important than hypotension. Hypotension is that blood pressure on page 7 of less than 90/50. Just remember that all shock has a blood pressure that is low. And where there's no BP, there is no PP, meaning blood pressure, meaning BP, blood pressure, means blood perfusing your kidneys. So if you ain't got no blood pressure, you ain't gonna have no PP, because your kidneys can't make urine when they're failing. Hypoglycemia. I want everybody to know out there in the wonderful little nursing student world that hypoglycemia will kill you way faster than hyper. Your brain needs sugar to function. And when you are hypoglycemic, and don't forget the classics, sweating, shaking, confused. The sweating is a good one. It's probably the most important one. So diaphoretic, sweating, perspiring, clammy, cold and clammy, give them candy. Cold and clammy, give them candy. Hot and dry, your sugar high. Hot and dry, your sugar high. Y'all better know. So that's it. Now let's have fun and test my theory. Did you remember I said you have to know the context of the question? Let's do 2 questions. All right, again, this is the nurse on a pediatric cancer unit. She's checking her patient's labs like I do when I first get to my floor, and I'm checking all my patient's labs, make sure I ain't got no nightmares. And when she's checking the labs, who should she see first? Y'all better be writing this down. Patient with a fever with a white blood count of 3.0 times 10 to the 9th degree liters. Don't let that scare you, honey. Don't let it bother your Jerry curl. All I said was the patient's white blood count was 3,000. That's all I said. Get your life together. Patient with nausea and vomiting, a potassium of 2.4 milliequivalents, or a patient with pallor and a hemoglobin of 8, or a patient with epistaxis with platelets of 98,000. Now the good news, on this new test, the Ngn Nclex test, on that test, you will have your normals right there. But your little ass should have knew the normals any damn way. So you should have knew that the white blood count normal is 5 to 10,000. And this brother here, this baby, this child, whoever the hell they are, got a fever with the white blood count of 3,000. That's one. Your little ass should have knew for the second patient that potassium 3.5 to 5.3, because you just flip the number back and forth, right? 3.5 to 5.3 is normal for potassium. And this sister or brother is 2.4. Okay, I'm gonna give you a little funky normals. I'm gonna play with you a little bit. Okay, then you got the patient with the pallor and a hemoglobin of 8. And you ought to know that a hemoglobin of 12 and a hematocrit of 36 is normal. 12 and 36. This sucker here is not 12, they're 8. You ought to also know them platelets. Them platelets, I don't teach ranges for platelets. I teach one number. I teach one number with most of this shit. The one number you gotta know is 150,000. Anything above 150,000 is normal. And I tell you another tip, and that's on page 9 of that Oh My God packet, that platelets less than 100,000, you're gonna have problems probably with clotting. So you got 4 patients. They all sound sick as hell. Now, which one you gonna see first? Well, let's try to implement some of this stuff, right? We already did the last 5 words. We already looked at numbers. We just did that. Now, you know what the most important part of this question analysis is? The context. What kind of patient you got? Cancer patient. What kind of patient do you have? A cancer patient. What else? Where are you? In a pediatric unit. Oh, okay, these kids. Who you dealing with? A bunch of cancer kids, right? Cancer having children, okay. But what about the when? It doesn't play a role. Nah, not today it didn't. It might play a role later, but right now, that wasn't in this question. Okay, now, let's look at, shall we? Let's look at my strategy, because I'm almost certain that you chose number 2. I can swear it on the Bible, because most of y'all do it on my little pre-assessment test. I'm almost certain you chose number 2 with your crazy self. Now, that ain't it, because look at here. Do it have potassium or electrolytes anywhere in this list? So what else is here? What about these platelets? Is platelets or bleeding anywhere in this list? No, it's not. How about that pallor and that hemoglobin? No, the hell it ain't. But guess what? Look at here. Patient with fever with white blood count of 3,000. There it is. Cancer patients are immunosuppressed, and this patient has signs and symptoms of an infection. They had a fever and a low white blood count. Motherfucker's about to be septic, and you missed it. Yeah, your patient died. Kid at that. You ought to feel terrible. Next, letter B. The patient is being monitored while undergoing a stress test using a treadmill. Here's the numbers on that. Which finding concerns you the most? Is it the patient that complained of chest pain level of 3? Is it the one with the blood pressure 164/90? What about that heart rate of 138? How about the pulse ox less than 91? Okay. Now this one, I gotta tell you, I told you there's two things you gotta remember when answering priority questions. One is which one will kill you, which symptom will kill you, versus which one is not to be expected. It's not expected. Okay, we're gonna combine them for this question. Here we go. You probably thought after my little story about the pulse and your patient could be bleeding and all the rest of this shit, you might have thought the heart rate of 138 sound crazy as hell. You might even thought airway, pulse ox, the oxygen level being 91% is bad because you were taught that ABC shit. Ain't neither one of them to answer, because let's think about it. Your patient is taking a stress test and they on a damn treadmill. Okay, you forgot what a treadmill was. Basically, that's exercise. If that's exercise, your exercising ass ought to have a higher heart rate. In other words, your heart rate does go up when you exercise. That's an expected finding. That ain't the answer. When you exercise it and you're doing it on a treadmill for a stress test, like you literally got ordered a stress test, then am I really surprised that your blood pressure is high? Because for you to qualify for a stress test, might be some cardiac going on. You might have some pre-existing hypertension. That's why you got to know what the indication for a stress test was. It was chest pain. Remember that? Okay. So no, I ain't worried about your little funky 164/90, because I already know that's high, but it ain't the one on page 7 in the Oh My God packet. The blood pressure I told you was who you see first on page 7 was 180/120. And you only need one of them numbers to see them first. This does not match that. So you got to know your Oh My God packet. How about the pulse ox? Hey, I told you with respiratory distress, you needed a pulse ox less than 90. Honey, your little ass got to 91%. You cool. Go on, get away from me. Well, Shelly, that only leaves one. A chest pain level of 3. And you might have thought, well, Dr. Shelly, a 3 ain't that bad. Shit. You on a treadmill, walking, doing a stress test, and you got chest pain. Sound like a heart attack, fool. That's what the whole point of the stress test is, to pick up on somebody's ischemia. Okay? So yeah, any chest pain, and I got another one for you. Any chest pain and any leg pain is an emergency when you're on a treadmill. And this brother here has chest pain. He could be having a heart attack. Most likely he might be experiencing a heart attack. And there you was, fucking with a pulse ox. Nah, Now listen, I got to go because it's hot. I'm tired. I'm on call this weekend. I just left the hospital. Everybody and their mom-in-law needed a scope. I'm tired, y'all. I'm tired. But I hope this helped. Deuces. Stay tuned because we're going to be walking that Oh My God packet. Oh, and by the way, if you need an Oh My God packet, ain't number $35. Get your shit together. Find you $35 and text me at 216-410-0936 and tell me you want a quickie. I'll see what I can do for you.